It is a wonderful, though chilly Wednesday morning, the 10th of April 2024. Winter is slowly but surely creeping in, and I trust Namibia, you are keeping warm wherever you find yourself. Greetings, land of the brave and beyond, and a very, very warm welcome to today's Cabinet Committee briefing session, coming to you live and direct from the Government Information Center studios in the heart of the nation's capital. Now, Namibia, you are tuned into the Cabinet Briefing Session, a national platform that is initiated by the Government of the Republic of Namibia, emanating from the Cabinet or Government Communication Strategy that was rolled out by the Ministry of ICT late last year. Now, the platform is initiated to serve as a conduit for transmitting information on government projects, programs, policy formulations, and advancements, but also the strategic implementations within the respective OMAs. And the aim thereof is to fast-track information dissemination across all organs of government. For this morning's edition, I am your host, Hileni Feleba-Samunyela, and I am delighted to introduce to you the Minister of Health and Social Services, Honorable Kalumbi Shangula, to present to the Namibian nation his ministerial address.
Thank you very much for this opportunity. Fellow Namibians, on the 13th of March 2023, the Right Honorable Prime Minister Dr. Sarah Akugongera-Amadila launched the 2023 census preliminary results. The population of Namibia has increased from 2.1 million in 2011 to over 3 million in 2023. This increase in population size has implication on delivery of health and social services, as most of our health infrastructure were established when the population of Namibia was 1.4 million people. As the population size increases, so does the health and social needs, which the Ministry of Health and Social Services has to meet in line with her mandate. I'm pleased to share information with the public on the activities of the ministry during the preceding year. The overall mandate of the ministry is to provide quality public health and social services to the Namibian people. More than 85% of the Namibian population depends on public health and social services provided through hospitals and other health facilities managed by the ministry. This includes 322 clinics, 56 health centers, 34 district hospitals, 4 intermediate hospitals, and 1 national referral hospital. In addition, there are more than 1,150 outreach points. The portfolio of services offered at public health facilities consists of primary health care services, including health promotion, prevention of diseases, curative interventions, immunizations, as well as tertiary and specialized services offered at our tertiary health care hospitals. The ministry has implemented and is implementing various programs, projects, and undertakes activities to expand and improve access to public health and social services. The projects include the construction of new health facilities, maintenance of existing ones, procurement of medical equipment, pharmaceuticals and clinical supplies, ambulances, and the accessories. I have explained some of these efforts during the motivation of the budget of the Ministry of Health and Social Services in the National Assembly on the 2nd of April 2024. It is notable that the achievement recorded by the government of the Republic of Namibia has been recognized at regional and international levels. For example, in March 2023, our country received an award from PEPFAR in recognition of the remarkable progress that Namibia has made towards reaching the UNAIDS Fast-Track 95-95-95 targets and the efforts towards ending AIDS as a public health threat by the year 2030. Similarly, on the 16th of February 2024, our country received 2 awards from the Director General of the World Health Organization. The first one is the certification on the achievement of the silver tier on the path to elimination of mother-to-child transmission of hepatitis B virus. The second one is the certification on the achievement of the bronze tier on the path to elimination of mother-to-child transmission of HIV as a public health problem. The official presentation of the awards will be done in the near future. Namibia is in fact a trailblazer and has been recognized by the World Health Organization for being the first country in the world to complete a global review and meet the criteria for the path to elimination of hepatitis B virus. These important achievements underscore the great strides Namibia is making through the implementation of our public health interventions. This further means that the health of our people, especially the health of the mother and children, will continue to improve, accompanied by the positive spin-off for the country in general. With that background, I'm pleased to share some of the activities of the ministry at this platform. As announced by the Minister of Finance and Public Enterprises, for the 2024-2025 financial year, the Ministry of Health and Social Services will receive an amount of 10.9 billion Namibia dollars. Of this amount, 10 billion 434,000 millions and 17,000 is allocated for operational expenditure, while an amount of 457 millions is allocated for infrastructure development. The total allocation for the medium-term expenditure framework, that is for the financial years 2024, 2025 to 2026 to 2027 for the ministry, will amount to about 34.3 billion Namibia dollars. Let me share now information on capital project maintenance and public health infrastructure. The ministry has undertaken expansion and modernization of health facilities to facilitate better access to health and social services. Hospitals and other health facilities play an important role for the delivery of maternal and neonatal health, communicable diseases and non-communicable diseases, specialized social and rehabilitative services. Over the 2023-2024 financial year, the ministry has been undertaking constructions, upgrading and renovation of projects of hospitals and other health facilities, including abandoned project, intensive care unit, dialysis units, and medical oxygen upgrade. Intensive care units. Prior to COVID-19, intensive care unit beds were limited to Windhoek Central Hospitals, Katutura Intermediate Hospital, Osakati Hospital, and Onajokwe Hospitals, with a total of 35 ICU beds. In order to limit referrals to faraway hospitals and for the convenience of the patients, the ministry has embarked on a project to construct intensive care units at various hospitals. To date, A total number of ICU beds created in public health sector stand at 97. The ministry is pursuing investment in intensive care units in all 14 regional hospitals. The ICU for Katima Muliro and Keetmanshoop District Hospital were already completed in 2023. The ministry has advertised bids for the construction of intensive care units at Windhoek Central Hospital Pediatric Units, Mariental District Hospitals, Hobabis District Hospitals, and Rundu Intermediate Hospital. The construction of intensive care unit at Rundu Intermediate Hospital has already commenced, and I have the privilege to view it on Monday this week. For the Windhoek Central Hospital Pediatric Intensive Care Units, Mariental Hospital Intensive Care Units, and Hobabis Hospital Intensive Care Units, the contract awards are about to be finalized. With regard to Oshakati Intermediate Hospital, the bidding process for the development of the new intensive care units, the theater, and the central sterile supply department have been concluded. The construction of a new theater at Hobabis Hospital has started. Now let me move on to the other project, the dialysis units. We know that kidneys are responsible for removing waste products from the body. This is a vital function. Without one cannot survive. When kidneys cannot do their work, a person can be kept alive by artificially removing the waste products from the body through renal dialysis. Acute renal failure only requires short-term dialysis. However, chronic renal failure requires lifelong treatment. Oshakati, Rundu, and Windhoek Central Hospitals offer this service at intensive care units, but only cater for acute kidney failures. Oshakati Intermediate Hospital has 5 hemodialysis machines. Windhoek Central Hospital has 7 dialysis machines, while Rundu Intermediate Hospital has 2. The ministry is increasing renal dialysis treatment capacity at 7 hospitals to comprehensive, modern functional chronic dialysis unit with their associate accessories. As a result, Oshakati Intermediate Hospital will be equipped with 16 machines. Katutura Intermediate Hospital, 16 machines. Rundu Intermediate Hospital, 8. Keetmanshoop District Hospital, 5. Katima Muliro Hospital, 6. Walvis Bay District Hospital, 6. Otjiwarongo District Hospital, 6 machines. This is to limit the referral of state patients to Windhoek, Oshakati, and Rundu, and to private service providers. The renovation of renal dialysis unit at Windhoek Central Hospital Complex and the Oshakati Intermediate Hospital has been finalized. The commissioning and training on the use of the equipment at the 2 facilities will be conducted soon. The renovation of the units at Keetmanshoop District Hospital and Rundu Intermediate Hospitals have commenced, while for Walvis Bay and Otjiwarongo documentation and bids advertisement are currently in progress. For Katima Mulilo District Hospital, the bidding process is underway and evaluation of the bids will commence immediately after the closure of the bids. Let me now move on to the medical oxygen upgrade. The ministry continued with upgrading of medical oxygen network infrastructure at various public hospitals. The ministry, with its own financial resources, has procured oxygen generating systems, which are installed at Swakopmund District Hospital, Okakarara District Hospital, and St. Mary Hospital at Rehoboth. For Keetmanshoop District Hospital. The oxygen generating system was installed at the end of February this year. The oxygen generating plants for Kahao and Nana, Okongo and Adara district hospitals through the financial assistance of the Global Funds are installed and have been commissioned during the period 19 to 21st of February 2024. Construction and renovations were completed at Shamaturu Clinic, Karuha Clinic, Oskurufitu Clinic, Hetmanshoop, TB wards, Windhoek Central Hospital uninterrupted power supply system for theaters, Okakarara District Hospital laundry and kitchen, installation and commissioning of electricity backup generators in Andara, Okongo, and Okahao districts, and installation of additional groundwater tank reservoirs for Umthia District Hospitals have been completed. Construction is ongoing at Onamafila, Epupa, Linyanti, Okonjatu, and Malengalenga, Onankulo clinics, as well as at Awesome Care Health Center, which also include staff accommodation. Progress is also being made for the upgrading at Windhoek Central Hospital on Anjokwe construction pediatric ward phase A and installation of solar water heating system and water softening plant for the kitchen and laundry at Okakarara hospitals. With respect to the expansion of medical internship program, renovations are currently ongoing at Hetmanshoop Hospital, while procurement process for the dental unit at Katimamulilo District Hospital is underway. The contracts for Nanjokwe Maternity Ward, Sokopmut Neonatal Unit, and Muzi Clinic have been terminated. Completion of this project is usually delayed due to the non-performance of the contractors as a result of their financial and technical challenges. The ministry is busy finalizing the documentation to go out on bids for Sleep Clinic and Aranos Health Center accommodation, for which contracts were terminated. Bids are currently running for completion of the Oshana Regional Management Team offices, which projects were terminated due to non-performance of the contractors. Renovation of health facilities. The ministry continued to carry out maintenance on ablutions facilities, civil work in hospitals, general electrical work, and the cooling systems in order to sustain the required public health services. Completed renovations include: 1. Alteration and upgrading of the existing medical gas and vacuum system at Mariental District Hospital and at various hospitals in the Karas, Kunene, and Umsati regions. Tiling of the Chief Medical Offices, boardrooms, and Director's Office at Hetmanshoop Hospital. Partitioning of office for internal auditors at the Windhoek head office, and renovation of accommodation in Hetmanshoop. Minor renovation work and removal of old vinyl floor and temporary pharmacy storage at Walsall Bay Hospital has been completed. Civil work for Ward 2 and 3 at Otapi District Hospital has been completed. Renovation of Nankudu Hospital Pharmacy, Mangeti June Health Center, and Gamma Clinic have also been completed. Renovation of Ochiwarongo Hospital's theater, then the renovation of the elevators at head office and various elevators at Katotura Intermediate Hospital, the installation of air conditioning system at Ochiwarongo District Hospital Theater, as well as Rundu Medical Store warehousing. In preparation for installation of field hospital through the American Embassy, concrete slabs were constructed at Otapi and Katimamulilo District Hospitals. Upgrade of sewers reticulation for Psychiatric Ward 16 at Intermediate Hospital of Shakati, and plumbing and drainage system at the isolation ward at Intermediate Hospital Rundu, as well as the refurbishment of water reticulation system at Ritwoog Clinic. So all these projects have been completed. The following are ongoing renovation. Major renovation at Katutura Intermediate Hospital, which include civil, electrical, and mechanical services for floor 2 to floor 8, throughout to floor 8, west and east wings. The 7th floor renovation has already been completed, and renovation of the other floors have commenced. This renovation is a joint undertaking between the Ministry of Health and Social Services and the Ministry of Works and Transport with regard to technical and financial support. The repair of the elevators at Windhoek Central Hospital, installation of water tank towers and connection to the water reticulation system at Mariental District Hospital, Kalkrand, Hoaganas, Stamprit, Huntis Bay, Uchibingwe, Oshalongo, Oshigambo, Orukupa, and Oshivero clinics. Installation of signboards at Huntis Bay, Uchibingwe, Tubusis, Uis, and Spitzkope clinics. Replacement of the existing roof structure at Talismanos clinics, Ohandungu clinics, and Okalongo Health Center. Renovation of Eunda and Isizwe clinics. Removal of old vinyl floors and installation of new vinyl floor in Intermediate Hospital and Nanjokwe theaters. Renovation of Nahudu Hospital kitchen, as well as electrical work in the kitchen of Intermediate Hospital on Nanjokwe. Refurbishment of the incinerator at Ochiwarongo District Hospitals. Refurbishment of the sewer pump station at Angela District Hospital, and the construction of septic tank at Olukupa Clinic. Renovation of doctor's house at Nakudu Hospitals. All these projects, they are currently ongoing. Let me then move to another area. That's the Central Medical Store. The Central Medical Store is a government-owned entity responsible for procurement, warehousing, and distribution of all pharmaceutical and clinical supplies for use in public hospitals, health centers, and clinics in Namibia. The Central Medical Store has been experiencing a challenge in service level from as high as 92% in 2007-2009 financial year to as low as 58% in 2017 to 2018 financial year. This has been partly due to the procurement bottlenecks, poor on-time delivery by the Central Medical Store suppliers, increasing demand and order volumes by health facilities, and some organizational challenges at the Central Medical Store. The Ministry is keen to address these challenges and implement long-term solutions to ensure the sustainability of the Central Medical Store function. As such, the Ministry developed a Central Medical Store Namibia Turnaround Strategy Phase 2, which provide for improvement in storage infrastructure. One of the recommendations is to move the Central Medical Store to a new warehousing site, which allows for optimum operational smart warehousing facilities relevant to cater for the needs for the next 20 to 30 years. Second one, the Windhoek District Hospital. Namibia has adopted the primary healthcare model that aims to promote preventive health services among the population. This is defined in the Essential Health Service Package, which articulates the type of services that must be available to the public at every level of care. In the Khomas region, the Windhoek Health District, healthcare services are provided through outreach points, 10 clinics, 2 health centers, and Katutura Intermediate Hospitals, which serves as a district hospital in support of the facilities network. Operating hours for the clinics in Khomasdal Health Center, they are from 8 o'clock to 17 hours on Monday to Friday. Katutura Health Center is operational on a 24 hours basis. Inpatients and casualty service are not provided. The Katutura Intermediate Hospital is currently functioning as a mixed Level C district hospital and Level B2 intermediate referral hospital. The Windhoek District Hospital is envisaged, this is a new project, a new hospital, is envisaged to provide general outpatient and inpatient care in order to reduce the workload and referrals to Katutura Intermediate Hospital, which will then serve as Class B facility in the referral pathway, including receiving patients from countrywide district hospitals and also to serve as a training center for interns in the different health disciplines. Katutura Intermediate Hospital will also then focus on specialized services, training, and research. The Windhoek District Hospital will provide relief to the Katutura Intermediate Hospital and will free up space for specialized services. It will also reduce congestion, long waiting times, and overcrowding in the wards. The progress attained to date is as follows. Establishment of an interministerial committee and interministerial technical committee to oversee the development and implementation of this project. Consultants have been appointed for the feasibility study of the Windhoek District Hospital. The proposed hospital site has been allocated as portion 1024, a portion of the remainder of Farm 508 by the City of Windhoek as per City of Windhoek Council's Resolution 08/01/2017. A perimeter fence has been erected around the allocated land to ensure security. A submission for specialized services, that is topographic and geotechnical surveys and environmental impact assessment, have been submitted to the Ministry Procurement Committee for processing. The confirmation of this appointment is still pending. Resources is being mobilized through MTF and it amounts to over 2 billion Namibia dollar. The groundbreaking ceremony for which will mark the commencement of the construction of the district hospital will take place on the 9th of May 2024. Next is the Namibia Institute of Public Health. The COVID-19 pandemic has heightened the urgent need for the establishment of Namibia Institute of Public Health that is able to efficiently coordinate the response to the public health threats. Cabinet has approved the establishment of the Namibia Institute of Public Health, whose scope pillars are public health surveillance and epidemiology, public health laboratory systems and networks, public health workforce development, public health emergency management, and public health emergency operations center, and lastly, public health operational research. The Namibia Institute of Public Health is envisioned to play a critical role in generating, synthesizing, and interpreting data, and using this information to make recommendations to support ministries to make informed policy and program decisions. The Namibia Institute of Public Health will provide national leadership and expertise in driving the public health function nationwide, while linking the country to the global health community in prevention and control of diseases and epidemics. The Institute will be a critical foundation for the public health delivery system and will provide early warning signals of health risks and hazards, compile data to support outbreaks investigations, identify the causes of disease to aid prevention and treatment. The Namibia Institute of Public Health will provide national leadership, competent expertise, and coordination of rapid, effective evidence-based public health emergency risk, thereby improving organization and agility to respond. Now let me move on to the National Human Resource for Health Strategic Plan 2020-2030. The National Health Strategic Plan, launched in 2020, envisages that by the year 2030, Namibia will have quality fit-for-purpose health workforce that is equitably distributed and effectively utilized to address the health needs of the populations towards the attainment of universal health coverage. In this pursuit, 4 strategic objectives have been adopted. 1. Align health workforce production capacity and quality to match population health needs and economic demand. 2. Optimize the health workforce recruitment, distribution, retention, and utilization in the public sector towards achieving universal health coverage. 3. Improve efficiency in health workforce management to catalyze health system performance. And lastly, increase investment in health workforce information and evidence generation for use in decision making. The implementation of this strategic plan requires concerted efforts at various institutions and stakeholders involved in the production, employment, utilization, regulation, and financing of the health workforce in Namibia, including those within the government, non-governmental organization, development partners, and users of health services. The ministry held a sensitization meeting with various institutions and stakeholders to create awareness on this strategic plan. The ministry is currently supporting a total of 65 medical officers who are specializing in various fields. Out of this number, 9 medical officers completed their specialization in the following fields: 2 in anesthesiology, 1 in internal medicine, 1 in pediatric critical care, 1 in psychiatry, 1 in neurosurgery, 1 in radiology, 1 in surgery, 1 in subspecialization of pulmonology. That is all during the 2023-2024 financial year. The ministry still faces a challenge of imbalance in skill mix, as there is a scarcity of priority health professionals in the labor market, such as optometrists, audiologists, dietitians, speech therapists, sonographers, dental technicians, psychologists, clinical technologists, orthopedic technicians, medical orthotists, and prosthetists. There is still a great need for funding of the training of undergraduates to study in the indicated priority fields. Further, the ministry conducted verification and validation of the staff establishment to identify gaps and use the information to develop and submit the 2024-2025 and 2025-2026 recruitment plan. A request was submitted to the Office of the Prime Minister to abolish 1,784 posts and create 1,871 posts and identify 1,493 additional posts and 861 positions for new services needed to align with the current health service need. There is inadequate fiscal space to expand the staff establishment in response to the population health needs. The approval from the OPM of the Minister's staff establishment is crucial to provide the essential health service packages toward universal health coverage goal. Additionally, budget provision is also required to fill the current vacancy and additional staffing need which have been identified. A sector-wide analysis, workload indicators for staffing needs, was conducted to determine the needed workforce based on health service needs and revision of staffing norms, and the report is currently in its final stages. The Ministry, with the support of development cooperating partners, rolled out integrated human resource information system to manage the health workforce. It is currently functional in all regions and the 5 referral hospitals. The integrated human resource information system will enable the Ministry to generate reports, including annual health workforce status report. However, the Ministry is challenged by inadequate ICT equipment, including internet and internet networking. Let me now move on to the universal health coverage. The Ministry, in fulfilling mandate given by the Cabinet of the Republic of Namibia in March 2022, has developed the Universal Health Coverage Policy Framework for Namibia. This report outlines the progress made thus far in this crucial endeavor. Universal health coverage aims to ensure equitable access to health care for all individuals, regardless of their socioeconomic status and without incurring social and financial hardship. Throughout the development process, the Ministry assessed Namibia's position in relation to universal health coverage, identifying strengths to maintain and build upon, and bottlenecks requiring resolutions. 1. Service availability. Namibia has made strides in ensuring essential health services are available to the citizens, with 76% of the population residing within a WHO recommended 10-kilometer radius of a health facility. Referrals linkages are established to ensure services are accessible where needed, contributing to the country's progress towards the universal health coverage. Service readiness and quality. Facilities boast high service readiness, surpassing the WHO benchmark for health worker to population ratio. While efforts to improve quality of service have been undertaken, challenges persist though in some public health facilities. Addressing these challenges is imperative for us to be able to achieve the universal health coverage. Equity and affordability. Equity remains central to the healthcare service reform, aiming to mitigate disparity in access to health care. While strides have been made in improving access, particularly for marginalized communities, challenges such as geographic disparities and gaps in service delivery still persist. Financial barriers are minimized with out-of-pocket spending at 8% in Namibia, well below the WHO maximum of 15 to 20%. Most people can access essential services without any financial hardship. We have a number of exemptions. For example, the elderly people, those who are 60 years and above, they will receive the health services and social services at no cost. Now, the following key milestones were achieved. Policy Framework Lodge. On the 27th of July 2022, the Ministry convened a consultative meeting at the Vindu Country Club, marking the initiation of the process to develop the Universal Health Coverage Policy Framework. During this event, goals aligned with a cabinet resolution were established, emphasizing the importance of broad consultation and engagement with stakeholders to ensure a common understanding and shared vision for universal health coverage. Implementation plan. An implementation plan was devised to guide the development of the policy framework. This included the formation of various technical working groups under the Universal Health Coverage umbrella, with invitations extended to relevant stakeholders to join based on their interest. Subsequent meetings, discussions, and engagements have been held to define the vision and delineate the necessary steps to achieve universal health coverage in Namibia. The Namibian government remained committed to meeting the Abuja Declaration obligations, allocating 15% of annual national budget to the health sector. Recent initiatives include a costed plan submitted to Cabinet for additional funding mobilization, focusing on infrastructure development, human resource augmentation, and service delivery enhancement. Going forward, the Ministry will continue consultation to develop ambitious yet achievable solutions tailored to the Namibian context, fostering a culture of continuous improvement in healthcare provision. As we navigate this journey, our commitment remains steadfast in building a resilient health system that leaves no one behind. Let me now deal with the social contracting for health service policy for Namibia. In tandem with this overall ministerial mandate, the Ministry developed a social contracting for health policy in 2022. The policy aims at guiding contracting for civil society organizations in providing essential health services. Social contracting is a process through which the government will contract civil society organizations to provide health services that the government has a responsibility to provide. This policy and implementation action plan will guide social contracting for the civil society organization to deliver essential health services in line with national health priorities. Social contracting policy will guide the Ministry and other relevant stakeholders to contract with civil society organizations to provide essential health and social services to the Namibian populations, especially vulnerable people, key populations, and hard-to-reach community. This community would face significant access barrier in the absence of civil society organizations. The policy will guide the social contracting in health service delivery for 10 years and will be reviewed after 5 years to ensure it aligns with the national program goal. It is further noted that emerging diseases, including non-communicable diseases and mental health disorders, are putting increasing pressure on the available resources. raising the need for more efficient approaches to service delivery. Social contracting and payment for result are some of the approaches moving the ministry from passive purchasing of health services towards strategic allocation, while leveraging key strengths in other stakeholders such as the civil society organization. Let me now move to the developmental social welfare sector. The provision of treatment and psychosocial support for alcohol and drug dependency at Etegamena Rehabilitation and Resource Center is continuing. This is vital in addressing substance abuse issues. The extension of outpatient services to additional regions reflect a commitment to increasing access to rehabilitation services beyond the capital city. We have introduced the implementation of the brief motivation intervention tool that enhances early detection and referral for individuals struggling with substance abuse. This underscores a proactive and innovative approach to treatment. We have established a National Action Committee on Suicide Prevention. This demonstrates Namibia's commitment to addressing the complex issue of suicide. Through coordinated efforts involving various stakeholders, the committee oversees activities aimed at raising awareness, providing support, and preventing suicide. By engaging community members and leverage resources effectively, Namibia strives to create a supportive environment that promotes mental health and well-being. As I move to the conclusion of my presentation, I would like to state that we do face challenges in supplying our hospitals and health facilities with the required medicines and clinical supplies as a result of factors inherent in our public procurement system. The ministry, together with the Ministry of Finance and Public Enterprises, is working hard to find solutions to these challenges. After years of waiting, we have now been informed that the Central Procurement Board have signed contracts for delivery of clinical supply and antiretroviral medicine to the Ministry of Health and Social Services with the successful bidders. This is a welcome news. The responsibility is now on the successful bidders to ensure that they do deliver as per orders. This will ensure that shortages of medicine and clinical supplies in our hospitals, in our health centers, in our clinics will no longer be experienced, and patients will get the quality healthcare services they deserve. The tender for the pharmaceutical products, however, is still awaiting High Court judgment. I record my profound gratitude to the members of the public for the understanding, cooperation, and support we have received, and plead for same going forward. The success that we have achieved was possible because of that support. I must stress the fact that health does not originate from hospitals, health centers, and clinics. Health emanates from our homes, the type of food we eat, the air we breathe in, and the way we conduct ourselves. Personal hygiene, physical exercise, and balanced diet guarantees the health status of an individual. Let us all allow the hospitals and other health facilities to deal with those conditions that are not amenable to prevention. But let us at all time remember that prevention is always better and cheaper than treatment. I thank you.
Indeed. Thank you so much, Honorable Minister, for that very insightful and quite promising update from your ministry. Indeed, your ministry is entrusted with a huge responsibility, ensuring that the Namibian nation is indeed taken care of health-wise. Now, this segment is deliberately set aside for the journalist in the House. If we perhaps have questions, or journalists that have questions and would like to pose to the Honorable Minister, you can take the mic over there and briefly introduce yourself and the media house you represent, and quickly ask your questions. No questions. Okay. So in absence of no questions from the media, that only means that, Honorable Minister, your update was indeed insightful and quite clear. We would like to then, I personally would like to pause here and thank you for the concerted effort that is shown religiously by your ministry, ensuring that the Namibian nation is indeed taken care of health-wise, and that our health facilities are on par with that of the world. Namibia, unfortunately, that is all the time we had for today's discussion. And we ask you to please follow us on our social media platforms and become part of the GIC family. From myself and the GIC production crew, until tomorrow, it's goodbye.